Hello, I'm Dr. Archana from Rajan Dental Institute and I specialize on lasers and aesthetic dentistry. Now, what are lasers? Lasers are light amplification by stimulated emission of radiation. Now, this sounds very complicated. In other words, you could call this a splendid light or special light. Now, we are all familiar with the electromagnetic spectrum, which we have studied in school. Now, this consists of the visible light and the invisible light. And the visible light fall within the 400 nanometers wavelength to the 750 nanometers wavelength. Now, the invisible light is two portions. Those that are below 400 nanometers will fall within the X-rays, the UV light and the gamma rays, which are actually damaging and harmful to the patient's tissues, and they are used mainly for cancer treatment. Now, the other part of the invisible radiation is the non-ionizing radiation, which is above 750 nanometers wavelength, and these are normally the infrared rays which are used for dental lasers. Okay, now, dental lasers that are used with low power settings are called low level laser therapy, and they are biostimulating and they help in healing of tissues. Now, normally after a tooth is extracted, you will see that some patients come back with swelling, pain, inability to open the mouth, and temporomandibular joint pain as well. Now, for these patients, it helps when we apply the low level laser therapy over the skin, over the joint, over the muscles that are affected, and instead of waiting for 10 days to feel better, they are actually much better in just 2 days. Now, when the settings are increased, the same lasers can perform cutting of the gums and cutting of hard tissues like teeth and bone. Now, I'm going to show you some cases here where you will see how the gums are cut and how the teeth are also are treated for removing decay without using the drill. Now, if you look at this case, the first case that I'm going to show you is the patient came here with a decay that was seen underneath the gums, and the entire cavity was not visible. So the laser was used by just using a little bit of local anesthetic gel over the area, and the gum was trimmed, and with this we were able to expose the entire region of cavity. And now it was easy for the specialist to apply the filling material. Now, this was done without using an injection, with just the local anesthetic gel. There was no bleeding, so we did not have to make the patient come again for doing the filling. The entire treatment was performed in one sitting. Now, if you see this other patient, she's been biting on her lip and she's formed a small epulis in this area, which kept coming in the way of her bite. Now, using the laser, again here we have marked the area that has to be trimmed off, and here you will see no bleeding but the tissue being removed, and the patient was comfortable. Now, again another case here where the patient was on medication for hypertension, where the side effect was enlarged gingival growth, and we have removed the entire tissue here, and you will see that again the field of surgery is void of bleeding. Now, this patient has gingival growth between this teeth here, and this is because of unhygienic conditions where you have calculus which is rough and triggers the gums to grow over it. Now, again here we have used the laser and trimmed that portion of the gum. Now, patients who've had implants done normally come back after about 6 months to have their implant crowns measurements taken, and we find that the gums have actually grown over the implants, and so measurements are not able to, we are not able to do the measurements. Now, in this case again we have removed the tissues that have been covering the implants. Immediately the impressions are taken, the gums have healed very well the next day, and within 10 days you will see that the patient has received their implant crowns. Now, why do we use lasers and not the blade to cut the gums? Now, one thing is there is very little pain, so we don't have to give an injection for the patient. The second thing is that there is no bleeding. As the laser cuts, it also seals the blood vessels and the lymphatics. Now, sealing the lymphatics means that you don't have a swelling. Now, less pain, no bleeding, no swelling, results in no antibiotics, no analgesics. So the patient is very happy after a dental treatment. Also, when we use the same lasers to cut hard tissue, like remove decay from teeth, normally we use a drill and the patient feels intense vibration over their teeth, and sometimes sensitivity and pain. Now with the use of laser, it is kept about 2 millimeters to 9 millimeters away from the tooth surface, and so the patient does not feel any vibration, sensitivity or pain. And after the decay is removed, the fillings are performed. This is the advantage of using the laser. Now if we want to combine laser work along with aesthetics, you will find that exposing a tooth surface that has not been erupted in a child can be done very easily. Now this patient has come to our clinic for orthodontic treatment, and we have waited for about 1 year for this tooth to erupt. Now she's almost 12 years old, and this tooth should have erupted when she was 9 years, but this did not happen. So we didn't want to wait further. So a laser was used, and the soft tissue that was adamantly sticking over the tooth was removed. Immediately the brackets were placed and the arch wire was connected, allowing the tooth to erupt. Now within 4 months you see that the tooth has almost come into the arch. Now this patient is a 35-year-old adult, and you will see that she's got some ugly smile, ugly teeth here, all malpositioned and crooked, and the cause for this is mainly thick freedom that has been attached from the lip between the tooth to the palate. Now using a laser, we have removed that tissue. You will be able to appreciate how bloodless this field is after the surgery. This is a picture taken immediately after the procedure. Now after this is done, the patient went through orthodontic treatment and had her teeth aligned. Now after teeth alignment, we want to still enhance our smile by brightening the tooth color. For this, bleaching can be done, and the conventional way of bleaching teeth will be by applying a gel over the tooth structure and waiting for the chemical reaction to take place. But with the lasers, the treatment is only about 15 minutes instead of 1 hour, and the laser light is applied over the gel, which enhances the chemical reaction. Now you will see that this is the effect of the laser whitening, done in about 15 minutes, less sensitivity, and the patient eventually goes out with white teeth, smiling happily. Even with that, all this done, still patients feel that they're not happy with their smile, and this can be because of excessive pigmentation over their gums. Now normally these pigments are removed using a blade and scraping the entire surface out. Sometimes even a diamond burr is used, and you can see that the patient is bleeding a lot and suffering with a lot of pain. Now with the use of lasers, as you can see here, half of this is removed. You can compare how pink the tissues are compared to this. No bleeding at all, and only an anesthetic gel was used. Now this is immediately after completion of treatment, and in this picture you can see the patient after about a week with pink gums and white teeth and well aligned teeth. Now this is how we enhance smile. Over here, another patient has come saying the crown height is small and she's broken her tooth, a front tooth, when she fell down. So we used the laser, trimmed off a little of excess gum, made the tooth appear longer, and here we have given her metal-free ceramic crowns. Now normally crowns come with a base of metal over which ceramic is covered, so you will see a black line along the gum margin. But when we use a completely metal-free ceramic crown, you don't see the black margin at all. Now this patient has had a fall and broken 4 front teeth, and we had to do root canal treatment for all the 4 teeth. Now we're matching the color here, and we have given him metal-free ceramic crowns, excellent matching, excellent aesthetics. You don't see any separation between the gum and the tooth crown. These are metal-free ceramic crowns. Now this patient came to us with a lot of space between the front 2 teeth. We have a very simple technique for this to improve the smile. We have just matched the color, we have taken a measurement, and we have given him a piece of material here which has just been stuck over the teeth. This does not involve any kind of preparation, no drilling, and no discomfort for the patient. Now this is how his smile was in the beginning, and now you will see that his smile, he does not show the space. We have just stuck the material over here. You might be wondering how big the machine is. Now normally an industrial laser is huge and it covers about the size of 10 tables put together, but the dental lasers are small. They are the size of a mini fridge, sometimes the size of a small clock, and sometimes the size of only a pen. Now let me tell you how safe lasers are. Lasers can be used also on infants. Sometimes a newborn baby comes with the base of the tongue attached to the floor of the mouth with a thick tissue, and because of this they're not able to suckle on the mother's milk. So immediately we are called and the laser is used to cut this tissue, and we apply only the local anesthetic gel and the procedure is performed. Immediately the infant is able to suckle and have their feed. Now if the lasers can be used so safely with an infant, definitely it can also be used for adults. So we just saw how lasers can be combined with aesthetics to enhance the smile of a patient. At Rajan Dental, you are in safe hands.